Senator Klein, I want to ask you about a theme that your colleague just raised, which is about racial disparities. One of the most striking and even shocking revelation has been the fact that people of color are dying and getting sick because of the coronavirus at much higher rates than are whites. What are you seeing in terms of your practice, and what concerns you about this pattern?
Well, thank you for questions. And as with everything in society, the coronavirus seems to have brought this into high relief. As we know, morbidity and mortality levels for people of color are much higher than they are for white people in our country with coronavirus. To put myself in context, I'm 52 years old. I went to medical school in the 90s. We did not learn anything about racial disparities in outcomes, healthcare outcomes, although now that it has seen the light, it's clear that that is a severe healthcare emergency and a societal failure. And it's caused me to sort of study myself, study my practice and the way I and my colleagues and the people around us as part of our support team have treated patients for the last 30 years and what systemic racism really means. If you were to ask me if I'm a racist person, I would say I personally am not racist at all. Have I participated in a system that is guilty of systemic racism? Yes, absolutely. And I'll give you a concrete example, Professor. I began examining, let's say we had two identical patients come into the emergency department. I was going to care for them. And one was a white woman from Golden Valley, 45 years old with abdominal pain. And one was an African-American woman from North Minneapolis, 45 years old with abdominal pain. And I began to examine how much time would get spent with each of those patients, how much symptom validation would they get, how quick would their pain relief be treated and aggressively, what studies would be ordered and how quickly, what would their discharge plan be. And it becomes apparent, I think, for any provider, once you start asking those questions and looking at your own encounters, that people of color have a different experience in our healthcare system, which I think in large part accounts for the differences in their outcomes. It's something that we really need to dig deep individually in terms of our own practices to plumb the depths of how this has been allowed to fester for so long.